Greeting, this is Ron from the Encyclopedia team. It is with great honor we have Professor Peter Konturek for this interview. Thank you for joining us, Professor Konturek.
Thank you very much. I'm happy to give you an interview.
So, Professor Konturek, please tell us a little bit about yourself.
Well, I am professor of internal medicine and gastroenterology at the University Erlangen-Nuremberg in Germany, and the head of internal medicine, gastroenterology, endocrinology, and infectiology at the Thuringia Clinic Saalfeld, teaching hospital of the University Clinic of Jena. And I am since 2001 a fellow of the American Association of Gastroenterology. I'm also a member of German Association of Gastroenterology, Bavarian Association of Gastroenterology, and Central German Association of Gastroenterology. My research focus encompasses different topics in gastroenterology, including inflammatory bowel disease, irritable bowel syndrome, molecular and physiological mechanisms of gastrointestinal protection and ulcer healing, gastric carcinogenesis, and molecular mechanisms of Barrett carcinogenesis. But of course, in the last year, the main interest area is the role of gut microbiota in health and in pathogenesis of different diseases in the gastrointestinal tract and outside the GI tract. And I'm also interested in different microbiota modulating therapies, such as diet, prebiotics, probiotics, symbiotics, or fecal microbiota transfer. And of course, the COVID pandemic had also a great impact on our research activities. So we also studied the interactions between gut microbiota and COVID-19 infection patients and also in long COVID. My clinical focus as gastroenterologist includes mainly diagnostic and interventional endoscopy, and of course the treatment of patients with inflammatory bowel disease and irritable bowel syndrome and food intolerances or food allergies. I am author of more than 300 original peer-reviewed publications and about 20 book chapters. And I'm also the member of the editorial board of Journal of Physiology and Pharmacology, and recently also of International Journal of Environmental Research and Public Health.
Thank you very much for a detailed introduction. So we noticed you are studying the gut microbiota and human health. Could you please explain more about it?
Yes, we know that the gastrointestinal tract is a home to nearly 1 trillion microbes that are comprised of bacteria, viruses, fungi, and other microorganisms. And this whole collection is called gut microbiota. And in the last years, the great advances in understanding the physiological role of gut microbes, gut microbiota has been achieved. And I think that we know that the gut microbiota has considerable influence on human health. And we study all these aspects. We know that every person has its own gut microbiota compositions, and this is influenced by a lot of different factors like diet, genetics, geographic location, medications, lifestyle, and so on. So meanwhile, we have strong evidence that gut microbiota had great importance, not only for digestion or absorption of nutrition, but also for the function of the immune system, for different metabolic processes, protection against infections, and also I would say the protection of gastrointestinal mucosa and participation in the development of so-called oral tolerance. So negative quantitative and qualitative changes in gut microbiota may lead to different diseases in the gastrointestinal tract and outside of GI tract. And one of the fascinating aspects concerning gut microbiota is the fact that the microbes communicates with different distant organs by so-called axis, for example, with brain, with gut-brain axis, with kidney, or with lung, skin, liver, and so on. Example for the gut brain axis is, for example, the impact on different neurological or psychiatric diseases. Just if we mention Parkinson disease or Alzheimer disease, and concerning COVID-19 infection, we have a great importance of so-called gut-lung axis that also play a great importance in terms of the prognosis of the patients infected with COVID. So I think that we should also mention that gut microbiota is responsible for the production of the huge battery of different metabolites, neurotransmitters, short-chain fatty acids, modified bile acids, indole derivatives, and so on. And we are just at the beginning to learn how these metabolites influence our health. So in summary, I would say that the human microbiota have a crucial role for well-being and survival of the organism.
Thank you. So, what makes you want to research this subject? Did you get any influence by other people?
Well, I think that, of course, the biggest challenge at the moment is the question whether the changes in gut microbiota contributes to the diseases or only reflects the disease status. So we still have not answered these questions, and I think we need more studies, basic studies, clinical studies to answer these questions. I see a lot of challenges in the microbiota research. First of all, development of healthy microbiota during childhood, because this is the most important phase for the establishment of gut microbiota. Second, I would say a role of gut microbiota in aging processes, age-related diseases like Parkinson disease or Alzheimer disease. Role of gut microbiota in chronic inflammatory bowel diseases or in functional diseases of gastrointestinal tract, such as irritable bowel syndrome. A very big important topic is also impact of gut microbiota to host metabolism, obesity, type 2 diabetes, chronic metabolic fatty liver disease. And finally, one of the most important topics is also the role of gut microbiota in the carcinogenesis, because we have more and more evidence that the microbes are responsible for the promotion carcinogenesis and have great impact also on the chemotherapy or response to therapy. So, of course, I follow the literature that is published in different journals, also in your journal, and we also organize different conferences on gut microbiota or webinars, and in October this year, I will organize as the president of the International Microbiota Society conference in Paris on gut microbiota, getting microbiota. I think it's a very important multidisciplinary conference focus on different aspects of microbiota research. So I think that great developments in this area. We are still far from translating the basic science into clinical practice. So this better knowledge of gut microbiota, I think, both healthy and disease state will encourage the development of innovative diagnostic and therapeutic modalities for diseases.
Fantastic. So what is the innovative part about your research?
First of all, it's the use of different gut microbiota modulating therapies. We investigate the role of fecal microbiota therapy, especially in patients with Clostridioides difficile infection. We know that this infectious disease is one of the most, if not the most prevalent healthcare associated infection with very high rate of recurrences that are very difficult to treat with antibiotics. And fecal microbiota treatment restores healthy gut flora or microbiota and is very effective for treating recurring Clostridium difficile infections with nearly 90% cure rate. It's also important that this therapy can be used also in older patients, in frail patients, and this treatment brings a huge benefit and limits the possible complication like colectomy, sepsis, or even death of the patient. So we are also studying this role of FMT in other diseases like inflammatory bowel disease, food intolerances, food allergies, or irritable bowel syndrome. Of course, due to pandemia, all the studies have been stopped, but I hope that we can restart our research on FMT very soon. In basic research, we have studied extensively the impact of gut microbiota on gut-brain axis. We performed an experiments in rats exposed to stress and to colitis. And this experiment clearly showed that gut microbiota may significantly modulate the response to stress via gut-brain axis.
It sure sounds like further research will be needed in this subject. So, what is your next move?
Well, I think that we concentrate now on studies on the role of gut microbiota in patients with long COVID, because this devastating disease led to this complication in many patients. So first, we want to see if gut microbiota plays any role, but we have more and more evidence that it is the case. And of course, the next step would be to modulate gut microbiota in order to improve this disease. That's, I think, the further research. Of course, we have also another basic research projects, especially on the role of gut microbiota and obesity and metabolic disease. This is very, very important topic. We know that gut microbiota plays a very important role in the development of chronic liver diseases, especially of metabolic fatty liver disease. That is at the moment the most common liver disease worldwide, leading to liver cirrhosis and liver cancer. So we want to investigate in the next future the role of gut microbiota in these conditions.
We sure hope the pandemic will end soon with the help of your research.
So thank you.
So, our next question is, what appealed to you the most about the International Journal of Environmental Research and Public Health? What made you accept the position of editorial board member of this journal?
International Journal of Environmental Research and Public Health is an important interdisciplinary journal, covers a very huge number of important topics, especially public health, environmental health, occupational hygiene, health economic, global health research, and of course, gut microbiota. The impact factor was last year, I think, about 3.4, but we expect that it will further increase because the papers, the publications there are very, very important and very good. I think that the strong side of this journal is also the interdisciplinarity and short and stringent publishing process. So the spectrum of the journal is very broad, including original research papers, extensive reviews, case studies, and I'm very happy and proud to be part of the editorial board of the journal.
So, your vision for the future of this journal is very optimistic, right?
Absolutely. I'm very happy to be part of editorial board, and I think that we will increase the impact factor in the next years. And I hope that more and more scientists will submit interesting papers to the journal.
Thank you. We wish you and your fellow colleagues the best of luck on your future research. And thank you again for joining us, Professor Konturek.
Thank you very much. Thank you very much for the interview and for the good questions. Bye bye.